Hi, I'm Dr. Arshad, Consultant ENT Facial Plastic Surgeon. I'm based at Leeds Private Hospital. I'm making this video for you today to speak to you about rhinoplasty and the various approaches. One of the most common procedures I perform in my practice is actually rhinoplasty, and patients often ask whether I do an open versus closed approach. In this video, I'd like to share with you some of the thought process that go through my mind when I'm assessing a patient and advising the best approach. Open rhinoplasty involves making an incision on the external aspect of the nose, and this incision is placed on the skin in between the nostrils. When I place an incision in this area, I'm able to lift the skin and soft tissue envelope off the nose and the framework of the nose, so the cartilage and the bone, and this allows me to achieve a very good exposure and manipulate these structures to achieve the desired outcome. When you place the incision, it's really important that the incision is as hidden as much as possible. So I use an inverted V incision, which heals very well. We ensure a meticulous closure so the incision is not visible once it's healed. In a closed approach, the main difference is that the incision is made on the inside of the nose, on the internal lining of the nose called the mucosa. And typically I place this incision in between the upper and the lower lateral cartilages. The advantage of this approach is that there is potentially less swelling and quicker recovery time. However, this approach cannot be used, i.e. a closed approach cannot be used in all circumstances. So there are some specific times where I will prefer to use a closed approach versus an open approach. And in order to understand this better, I'd like to refer to this illustration. When I assess a patient's nose, I like to examine from the outside, an external assessment, but also from the inside. When I'm assessing from the outside, I try and visualize the nose in three different separate compartments, what we call the thirds of the nose. So the upper third of the nose is bony, and we can all feel the bony external aspect on the upper part of the nose. The middle third of the nose is cartilage, and that's made up of the upper lateral cartilages. The area between the upper and middle part is called the keystone area, or the bony cartilaginous junction. Then the lower third of the nose is what's made up of what we call the tip complex. When I have a patient that I've assessed and understood their requirement is to manipulate the upper bony part of the nose, in that case I may not need exposure of the tip complex. Therefore, I may choose in that scenario to do a closed approach, i.e. make an incision on the internal aspect of the nose and approach the bone from the inside without having to lift all of the skin from the tip of the nose. Again, the advantage of this is that the healing is quicker and there's less swelling. It's really important to stress that there are advantages and disadvantages of both approaches. However, there's no one size fits all. So when I see a patient, I like to assess them carefully, both the external aspect and the internal aspect of the nose, and then understand what it is that they require from the surgery. Once I've done this and collated all the information, then I can make a surgical plan that's bespoke for the patient. And that's the important point of this video. There is no one single approach that is better for a patient. The individual needs need to be considered, and the examination findings need to be understood carefully, and what the surgeon can achieve. And in my hands, I do both open and closed approach, but in certain circumstances I will advise a closed approach. However, the majority of my surgeries for rhinoplasty are using the open approach. If you have any further questions about open or closed rhinoplasty or rhinoplasty in general, I'll be more than happy to assess you or answer your questions. I'm happy to do a consult, and I look forward to seeing you at Leeds Private Hospital. Thank you.